want to share a little video about PR interval. This is on the ECG. With the ECG, you have the P wave that represents atrial depolarization. The QRS complex represents ventricular depolarization as well as atrial repolarization, and the T wave is ventricular repolarization. So now that's just kind of a baseline. The PR interval actually begins at the beginning of the P wave and ends at the Q wave. So of course it would make more sense to call it the PQ interval, but this is a misnomer that's just historically passed down. It's kind of like basal ganglia. Ganglia doesn't make any sense. That's a group of neuronal cell bodies outside the central nervous system. Basal nuclei is a better term. They're trying to push for that, but basal ganglia is still going strong. So is PR interval. So occasionally you don't have a Q wave, and PR interval may be a better alternative, but for the most part you have a Q wave, and a PQ interval would be a better term. Some people use it, but this is the PR interval. Normal is between 0.12 and 0.2 of a second. So in other words, it's 120 milliseconds to 200 milliseconds. And what does that represent? Well, you know how ECG, it has time represented as, it slides by. This should all fall within 3 to 5 little boxes, or just one big box. So over here, here's one big box. It actually has 25 little boxes in it, but we're just kind of looking at it lengthwise. So that's the 5 little boxes within the big box. It should be between 3 and 5. So that represents 0.12 to 0.2 seconds. So that's what you want to see that in this little interval here. What does it represent? If this is the heart, this is the sinoatrial node, this is the atrioventricular node. It is the syncytium of the atria as they contract together through the AV node and that electrical impulse through the bundle of His right before it splits into that right and left bundle branch. This represents this, which is the PR interval. So what if it's longer than 5 little boxes? What if it's longer than 0.2 of a second? That means that you have an AV block, first degree AV block. So it's just longer than it should be. That's a first degree AV block. And that could cause some bradycardia because you're not going to have as fast of a heart rate. And so you have first, second, and third degree. I'm not going to get on into all the nuances and everything about it, but in the second degree block, you can have multiple P waves in a row. So you can have a P wave, another P wave before you even get to a QRS complex. And then when you get to a third degree block, that's nothing passing through electrically through the AV node. And you just have the atrium ventricles just depolarizing independent of one another. And so that's the worst one by far. And I hope this helps you understand a little bit about the PR interval.